Good morning. Good morning, Dr. Lonquist. Thank you for joining us. Before we begin, perhaps you could introduce yourself, tell our audience about who you are and a little bit about your history and why you chose, out of all the topics that I kind of gave you a choice of, this topic about teaming and leading a team for discussion.
Good morning, Kathleen, and thanks for inviting me. So I'm Jim Lonquist. I'm a cardiothoracic surgeon and have been in practice for 27 years now. And when Kathleen called me, I thought about what topics would be most appropriate to talk to new leaders about. Part of being a team rose to the surface very quickly. I think in some ways, my chosen specialty lent itself very easily to the team approach. It takes a village to get a cardiothoracic surgery patient from the admission desk to the discharge desk. One day I counted up, it was 200 people by the time you had all the shifts and all the departments that are involved in that. So it became very evident to me that I needed to pull that team together. The second thing, it also became very obvious to me early in my career that far and away our best results with patient quality and patient safety and patient satisfaction would happen under a team approach.
Oh, excellent, excellent. You do have a great history. When you think back, you've been doing this 27 years, early on in your cardiothoracic years. Was there a great challenge that you faced in leading this team? I mean, must be overwhelming to come out of residency and all of that to begin leading a cardiothoracic team. Tell us about any of the challenges that you might have experienced then.
Well, that's an interesting question. I personally had trouble with trust and accountability. I came out of the era where if you want it done right, do it yourself. Well, that does not work so well in a team approach. And so I really had to back off of that mentality and trust my team members to do their job. Ultimately, when things fell through the cracks, and ultimately they do, when you've got lots of people working on different problems, accountability became an issue. And so that was part of where I had to get some training myself. Physicians aren't really trained to be leaders.
Mhm.
We are sometimes asked to be leaders if we happen to do a good job with our patients. So when it came to what I needed to work on, I really had to not only communicate well with my team, but to ultimately trust them to do their jobs. And then when things fell through the cracks, we would back up and look at, well, where things went wrong and how to make accountability part of that team approach.
Wow, that's excellent and good wisdom that you've learned. We can apply that anywhere. Um, when you think about, you talked about leading a team of multidisciplinary team, basically for cardiothoracic, versus leading a team of peers. Were any different skills needed when you think back on, leading perhaps as you were the department chair, I believe, for cardiothoracic, and I think still are, or cardiology. Any differences in creating a team in those two areas?
There definitely are, although there are many similarities as well. I think that the differences in cardiothoracic surgery, we have an advantage because in that operating room, we're together many hours a day, and we're always communicating. We always are focused on the same task. And in many ways, that makes it simpler. We have ample time to talk, brief before the case, talk about what things are happening during the case, and debrief after the case. It's a bit more challenging when you talk to a group of peers, and that time together is nowhere near as frequent. For instance, if you're meeting, an hour a week or an hour a month, you really have to make that time count. So number one, I think when you are together, make that communication salient, important. Don't waste people's time, but also get the point across. Secondly, there are opportunities for sidebars. And so things that happen in large groups can sometimes be deconstructed under one-to-one meetings or one-to-two meetings in the hallway. And I've used that very effectively in meeting with peers. Definitely a different approach. The great similarity is we are all after the same thing to make sure that we do the absolute best for our patients.
Ultimately, the best thing. You're right. So one of the slides in our general session before you're here was about the four components of a team: respect, competency, trust. You already talked about sort of the trust and the accountability, and communication. When you think about, you've just joined your latest organization, right, in the last
2 years.
Yeah. So it's hard. And a lot of our leaders here today may be going from a peer to a new role, to a new position. What are some of the things in your style that you do to build trust and confidence in the people you're working with, especially when you're new?
So out of that list you mentioned, communication rises to the very top. And we need to make a connection to our team members. Um, Transparency is right behind that. And sometimes it gets a little bit dicey if there truly is a confidential matter. And oftentimes that happens at the C-suite level or mid-management level for nursing leaders. And when that happens, there is a way to get around that. Sometimes those hot seat questions will say, well, you know what, we've been asked by our leaders to keep that confidential, but everything else seems to be on the table, the wins, the losses. And then secondly, as you start to look at really trusting a team, there's got to be a commitment to educate your team members, whatever that looks like. It can be as the leader personally educating them, or sometimes, we have educators that do that for us. But having the communication to learn with that feedback that they have learned their competencies really goes a long way to build that trust.
Excellent. The other important thing that in our experience, a lot of interdisciplinary teams feel there's a lack of respect for the different an RN doesn't feel respected by the physician, a PA or an NP or a tech. What have you done particularly to make sure the people you work with feel that they're respected and valued?
Yeah, and that's critical. I think that does come from the top down. So as leaders, it is our responsibility to make sure that not only do we show that respect, but find ways to recognize contributions. I'm always looking about managing up. And Kathleen, that's one of the things you taught me. And for instance, when I walked into a room, the nursing team had already managed me up, so the patient thought I was the best thing since sliced bread. And then I met that expectation. Same thing can happen when we're talking about other members of the team, recognizing them. Why are these supplies always there? Well, it's because of my tech will, and so important to be a member of the team. I think we do best by setting that example ourselves.
I love that. And it is important to acknowledge the contribution, because then people will repeat that over and over again. If they feel like somebody has acknowledged what I did made a difference, I have a greater tendency to do that again.
I did nominate Will as Employee of the Month at the hospital level. That's a true story. And
Good.
he's one of our techs who happens to do wonderful things.
You go. You are a role model. So a lot of, since COVID, since rapid change, and a lot of these new leaders here have, come maybe in a short period of time, we've learned a little bit about the concept of teaming. Basically, you may not be working with the same people every day. Your scope of practice may expand, and or shrink. How do you, in these changing times with changing people, keep everyone focused on the right thing? Is there any particular tips that you can provide us with that?
That's an easy one for me. And it boils down to, at the end of the day, what we want most is for our patients to do well, have safe care, have quality care. And I will sometimes chide my administrators, because sometimes if there's a meeting about the budget or supplies, patients not really mentioned. But I will encourage all leaders that are speaking to perhaps clinicians at some point in that meeting or at some point in that discussion, make sure you mention that this really is all about the patient. Whether it's trying to stay in the black, it's so that we can provide resources to take care of our patients. And I think all of us sleep best at night knowing that we've done the best that we can for our patient.
Yeah, you're right. And that's so in line with the most efficient, effective teams. They're very clear on their goals. So that makes perfect sense to me too. So finally, thank you so much for joining us. Any last tips or anything that you think is really the most important thing? I've heard you talk about communication, and keeping the lines open. Any other tips that you have for young, newer leaders emerging into new roles that you think is most important to remember?
Like one of the best lessons I learned was try to become as good of a listener as you are a leader, because your team members will tell you. Everyone's coming from a different background. Everything has something to offer. And some of the easy ones are, I usually pull up aside team members one by one just to talk about this. It can be done in large sessions, but I think you get more if you have that personal conversation. What's working? what do you really think and what you're most proud of on this team, and what's not, or what keeps you up at night, or what's the greatest challenge.
I
And you can get a lot out of patient or out of the team members by asking those simple questions.
Excellent. And you kind of closed the loop for us because we talked about that in our first session. Communication, one-on-one, building relationships, building trust. It happens one-on-one, not in a group setting like that. It can, but that's great. I appreciate so much your time. You have so much to offer. And we really, really appreciate you taking the time out of your busy schedule to join us. And if we have 2 more seconds, even though we're not talking about that, Dr. Lonquist and I worked for years. We've worked with him. Tell them your story about narrating your care and about safety, what safety means, and how you narrate that differently. Would you mind with your patient from that you never told her to not get her incision wet?
This happened very early in my career, and I did a coronary bypass patient. Back in those days, we were making big, long incisions to take out the saphenous vein for bypass. Every patient gets the same talk by me and by my APP staff and by the nursing staff. And it was, a page of instructions, and we verbalize things and keep your incision, dry. And so she comes back about 2 weeks later at a post-operative visit with erythema on the incision. I says, well, tell me a little about what's happening. And she says, well, I was walking along the beach because I practiced in Pensacola for many years, and the surf splashed up against my leg. So after I picked my jaw up off the floor, I said, we really wanted to keep your incisions dry. We need to bring her to the hospital. She ended up being on antibiotics and got a Vibrio and got Vibrio sepsis and died. And at first I thought, how could that possibly have happened? Why didn't she read the instructions? Why didn't she listen to me? We all told her not to get her incision wet. And then it came to me that something about the way she perceived this discussion had failed. And ultimately, it was a failure on my part and my team's part that we did not get that message across. And it completely changed my thinking about patients and their perception of what we're telling them. And, when patients are sick, they may not hear well. So that's just one of the many things that we have to combat when we look at complex clinical problems.
Right. Thank you so much for sharing that. And it stayed with me and others going forward for your safety. You don't want to get an infection for your safety. It's important for all of us to rehear that over and over again. Thank you again, sir. You have a wonderful day.
You're welcome. Take care.